Dr. Heather. How are you doing today? Yeah, okay, what seems to be the issue? You hit your head. Okay, do you mind if I take a look really quickly? Yeah, okay. Okay. Yeah, it seems like you have a pretty nasty bruise going on up there. So before I refer you to, sending you to the emergency room or anything like that, I'd like to go ahead and just quickly do a cranial nerve exam just to see if there seems to be any damage of any kind, or if it's just a superficial bump on the head kind of thing. Would that be okay with you? Great, okay. So just a couple of quick questions to start out with. Can I get your full name and birth date? Great. So when did this head injury happen and how did it happen? Okay. Playing football. Oh, okay. Yeah, we see a lot of this, especially this time of year. So you ran into another player, is that what happened? Okay. Was this during practice or a game? Were they coming, straight at you? Okay. Okay. Is there anything that you've noticed, a bad headache? Has your vision been blurry at all? Have you had any problems hearing or kind of changes with sensation or anything like that? Just anything that you can think of, really. Okay. Okay, that's good to hear. So hopefully this will just go completely smoothly and then we can just get you some medication and we'll just get you home and treat you for a concussion if you have one. But yeah, so I'll go ahead and get my tools together and then we can get started. Great, okay. Okay, perfect. So right now all I want you to do is just look directly at my nose and I'm going to just look into your pupils with this light and see how they react, if they're reacting normally to the bright light, okay? So just look directly at my nose, don't look directly into the light. Okay, and now I'm just going to pass the light over your eyes and see how they react. Okay, great. So now next I would like you to just follow the light with your eyes. Don't try not to look directly into it, but just follow where it's heading, okay? Good, okay. Great. So the next thing I'd like to do is just test your peripheral vision. And if you could just follow this pen and tell me when it leaves your vision, okay? So just look straight at my nose. I'm sorry, don't follow the pen. Look straight at my nose. And I'm just going to move this pen and you tell me when you can't see it anymore. Okay, good. 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 great job. So next thing, I just like to do a quick eye test. This isn't going to be too rigorous like you normally get at the eye doctor, but just to double check that you're still seeing letters correctly, okay? Can you read line 4 for me? Oh, good. P, good. E, good. D, good. Okay, what about line 6? E, D, F, C, C, P. Great. Okay, let's do one more. Can you read this last line for me? F, good. E, L, O, P, C, and D. Great job. Okay, perfect. So the last eye test that I just want to do quickly is just to follow my finger. This is another one to make sure that your pupils are reacting correctly so I can see whether or not you're able to focus on my finger as it gets closer to your face. So just stay completely still. Just follow my finger. Just look directly at the tip, okay? You're doing a great job. And perfect. You're doing a great job. Okay, now we'll move on. So now I'd like to move on to just doing a couple of hearing tests. So the first thing I'm going to do is just come close to you and whisper a series of words, and I'd just like you to repeat those back to me, okay? Are you ready? I'm just going to come close to you and whisper the word, okay? Perfect, okay. Shape. Shape, good. Royalty. Royalty, good, okay. Strategic. Strategic, excellent. Picnic. Picnic, great, okay. I'm gonna just get to do the same thing with a series of numbers, okay? Great, okay. 8. 8, good. 17. 17, good. 700. 700, okay. 34. 34, great. So I have one more quick hearing test. In this one, I'm just going to hum a note, and then immediately after, I'm going to hum a second note, and then you'll just tell me whether the second note was higher or lower than the first one, okay? Okay, here comes the first note. Second note. Good, okay. Let's do a couple more. Great, okay. One more. Great, okay, perfect job. So the next sense that I'd like to cover quickly is the sense of smell. So I just have a little vial here, and I'm going to put it up to your nose, and all you'll do is tell me what you smell, and these should be fairly recognizable flavors, so we shouldn't have any issues. I'm not going to give you anything too exotic or crazy, okay? Great. So just stay right there. Okay, here comes the first one. Oranges, great. Okay. And the second. Peppermint, great. And the third one. Vanilla, excellent. One of my favorites. And just one more. vinegar, right? I know that one's a little out of left field. I'm sorry to follow the sweet flavors with that. And now we're going to do a similar activity, but with your sense of taste. So if you would just stick out your tongue, and I have my little spray bottle here, and I'll just spray a flavor directly onto your tongue, and you'll tell me what it is. And once again, these should be pretty recognizable flavors, okay? Okay, so go ahead and stick out your tongue. Coffee, yeah, okay. Second one. Chocolate, perfect, okay. Okay, two more. Bubblegum, great job. And last one. Marshmallow, perfect. So now I'd like to just quickly test your sensation on your face. Make sure that everything seems normal there. So all I'm going to do first is just touch different parts of your face. And you can just let me know where you feel my touch, okay? Great. Good. 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 Great. Great. And good. Perfect. 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 And one last has to do with the sensation in your face. I just have my little regular old paintbrush here. And I have both the harder, pointier side and this brushier side. So I'm just gonna kind of go like this on your face, and you will tell me if you can feel either the hard or the softer, brushy side. I promise not to poke you too hard. Okay, so just close your eyes again. Good. 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 And great. So the very last thing I'd like to do is just test your facial control. You seem to have done relatively well during this exam, but just to make sure that you can do all of the faces, expressions that you normally would. So if you would mind just raising your eyebrows. Okay, now furrow them. Perfect. Now can you stick out your tongue? Perfect. Can you smile? And frown. And can you make a shocked face? Good job. And can you blink 3 times? Perfect. Awesome. Okay. So with all of our testing, it seems like relatively everything is fine, which is great to hear after such a nasty bunk. So what I would recommend is just going home, taking aspirin, and having someone watch you for at least 24 hours. And they will need to wake you up every hour if you do fall asleep, just to make sure that things are okay. If you do experience any other symptoms, like, for example, if one pupil is larger than the other, if you're disoriented at all, if any of the things that we tested today seem to be bothering you, then please just don't hesitate, go straight to the emergency room. But I would say that you will be fully recovered with just a couple of ice packs on that bruise, and you'll be good to go in just a few days. Great. So thank you so much for coming in today. I'm really glad that you did come in to get this checked out. But like I said, everything should be back to normal within a couple of days. And please do just go straight to the ER if you have any issues. And other than that, I hope you have a wonderful rest of your day. Alright, thanks. Take care.